My name is Dr. Linda Hughes, and I'm an interventional radiologist in South Florida. I've been in practice in South Florida for over 15 years, predominantly in Broward County, but we do treat patients that come from all over the state as well as the Caribbean. I very much enjoyed practicing in the South Florida area. I love the patients, I love the community, I love the culture. I also enjoy interventional radiology very much. Initially, I started out in medicine, and I made a conscious decision to go through the training for radiology and specifically interventional radiology because I think that this specialty is a fabulous, cutting-edge, innovative specialty within medicine. It's a combination of patient care, it's a combination of science and technology, it's a combination of computers, but I think what also is very enticing is the fact that these are minimally invasive procedures that we are coming up with that are replacing a lot of major surgeries so that the recovery time is shorter, the actual procedure is shorter, and we have very good outcomes. Having trained at both Harvard as well as Boston University, education is very important. It's important to me as a physician to be able to provide top care to my patients. It's also important for the patient to be able to make an educated decision and to understand what their options are. There are over 500,000 hysterectomies that are done in the United States every year. A third of these are for fibroids. Embolization is a non-surgical alternative to hysterectomy. Hysterectomy should be the last resort in this day and age. I think as a female physician and as an interventional radiologist, I have a responsibility to educate not only my fellow physicians, but also patients and the public that there are non-surgical, effective, safe, successful alternatives to hysterectomy. Traditionally, the procedures that we offered were in an inpatient hospital setting. We now have the option with a number of our procedures, including the vascular procedures as well as the fibroid embolizations, that we can perform these safely and efficiently in a clean, sterile, spa-like environment. It is a beautiful private setting on a lake in Fort Lauderdale, Florida. It has 8 private patient rooms, as well as 1-to-1 nursing to patient care, and 2 state-of-the-art interventional suites where we perform our procedures. There are over 3,000 board-certified interventional radiologists in the United States. Only 4% of us are actually women, and there are 3 of us in the South Florida area that are performing full-time interventional radiology. I am the only one in Broward County, and I take pride in the fact that the fibroid embolization procedure is one that I have really helped to grow and develop in South Florida. It's a procedure that I enjoy. We've had wonderful technical success, good clinical outcomes, and I think it's a procedure that women with fibroids need to be aware of when they're making a decision about what they're going to do to treat their fibroids. Educate, empower, enjoy life.